am joined by Dr. Diane Kersten, and she is with Harvard Eye. Well, welcome. How are you doing?
Thank you. Very well. Thank you. Thanks for having me.
Good. Now, we've talked to a couple of other doctors at Harvard Eye, and you have so many. I have to get through all of them someday.
Yeah.
And I know you guys have been going through preparing and cleaning and sanitizing and doing everything that the CDC and our governor, has directed us to do. So tell me a little bit about that real quick so we can let your patients know, or our residents know everything that you guys have done.
Sure. Well, we just moved to a bigger office, and in a way it was perfect timing because we have so much room for social distancing. And we've been very organized about, having the patients wear masks, we check temperatures, we, make sure everyone's feeling well and not coughing. Every room is sprayed down and wiped down between patients. Everyone's 10 feet apart. It's probably one of the safer places you could be these days, actually, is in our office. And the staff have been great. They've taken it very seriously as well, protecting all of our patients and staff.
Right. And it's amazing the things that everybody has had to go through. But, it could be a new normal as to what we're looking at going forward. So, this is just one step that we've done going forward. So if we have another one happen, we'll be certainly prepared.
Yeah.
That's for sure.
Yeah.
Now, what type of, I'm sorry, go ahead.
Oh, there are things in the office that are chaotic, though. For example, ophthalmologists hold up a little lens when we look in the back of the eye, and it's right, of course, over the patient's mask. So immediately the lens fogs up. So having to, and to talk with a mask on and have people hear you and understand explanations, it's just so much harder, I think, to not see people's mouth move and then, have them understand explanations. So it's been a challenge.
Yeah, it can be. Although I was speaking to a gal from the Hearing Well Club, and she showed me a mask that I thought was brilliant, is that it has a clear part right over your mouth. And she said for people who are hard of hearing, it was perfect because then they could read the lips. So maybe that's something we all should be going to.
That would be great. Yeah.
Tell me a little bit about what you do for Harvard Eye.
Sure. Well, I'm one of the partners. I've been with Harvard Eye since 1988. And I mostly do cataract surgery and LASIK and pterygium surgery, and predominantly cataract surgery. And I love doing it. Cataract surgery has become so much more sophisticated and involved and interesting because of new technologies today. When I started in 1988, everyone pretty much just got a simple lens implant, wore glasses afterwards. And today there's all these great options for patients to choose from. So it's been a fun time.
Oh, that's great. Wow, you have been doing this a long time, and
Yes.
seen the technology change over such a long period of time. Speaking of new technology, you have a new technology called the PanOptix Lens. Now, is that only for people who need cataract surgery?
It's predominantly for people who need cataract surgery, but there are people who are having it as a refractive procedure like LASIK, especially people who are over 50. If you're very farsighted and you're over 50 or 45, then LASIK isn't a great alternative. So having an early cataract surgery, or it's called a clear lens exchange. It's basically cataract surgery before the lens has gotten cloudy, and so it's not covered by insurance. Some people are having it done for that reason.
Okay, because I had LASIK surgery, but it's been probably 15 years, and I love it. But I can't see anything up close without glasses.
Yeah, that's very common, because of course if you see in the distance, once you're over a certain age, you're
right. So I'm having to wear my glasses often. So let's talk about this new PanOptix lens. So you have a couple of slides. Let's go through those and just kind of walk me through it.
Sure. Well, I should say for about 20 years we've had implants that are designed to make people see distance and close up. And in the very beginning, they had issues and weren't as great, of course, as they are now. And so this PanOptix lens. It's an Alcon lens, and it came out about a year and a half ago. They had a lot of experience with it in Europe. So in Europe, they've been using it for several years. And it became the most popular lens in Europe very, very quickly once it was released there. So what's different is that it's a trifocal lens. So you can see distance, you can see mid, you can see close up. And a lot of the issues that were there in the past with halos and maybe smudgy vision in some cases with the previous implants are much, much, much better with this implant. They've figured out the optics and the technology, and it's been really just so much fun to have a lens that works this well.
Well, so would you not need glasses then?
Right? You won't need glasses. Yeah, so it's
That's
kind of a
amazing.
miracle, because with cataract surgery, if you have distance vision and that's what you want, then you have to wear plus 2.00 readers. You won't see anything up close. And some people still want that, especially people who've always been wearing reading glasses and they don't mind them.
Right.
So, yeah.
So then, for instance, so myself, I had said that I can still see great far away, but up close, I can't. So is this an option for me?
Well, it depends on the person. It's a better option if you are farsighted and if you haven't had LASIK. So,
Oh, okay.
yeah. So the perfect person to have it done as a refractive procedure is wearing +3 glasses, +5 Vernier, wants to get rid of their glasses, hasn't had a LASIK or anything. But it is a possibility. Whether or not it's a good idea in your case, it depends on a number of different things that we check out in the office.
Okay.
Yeah,
Perfect. Well,
someone
that
in your
kind of gives me-
situation, I often will just have one eye done Vernier or wear a contact in one eye Vernier. That's a very common
Oh, yeah.
way to
Okay.
treat what you have.
Okay. And then, well, at one of the slides here, it talks about the results. So
Mhm.
what is that showing us? 99% to 98%.
So that is a survey of patients who've had the PanOptix lens, and it shows how many would choose it again, and 99% choosing it again really says a lot about the implant.
Yeah.
The previous implants that were like this, bifocal implants, a small percent would not adapt well to them or wouldn't like them, and that's been an issue ophthalmologists, cataract surgeons have been dealing with for a while, trying to make sure you choose the patients who are going to like them, because most people do. So when we have an implant that is so, well experienced, I mean, 99% saying they would do it again is really great. So.
Yeah, those are some high results for sure.
Mm-hmm.
And then why is this particular, other than what you've already mentioned, why is this lens different than some of the other lenses that are available?
The technology of it is kind of complicated in optics. I don't even fully understand it, but I equate it to a progressive bifocal, that when progressive bifocals first came out, they weren't really all that great, and people didn't like them, and they were too narrow in the reading, and then they worked out how to make the optics work better, and they've done that with this. So it really works like a progressive, even though it's not in an up to down kind of a design. It's a circular design, but when you go from distance to near, there's not a jump. You just naturally are able to do it. So yeah, and I wish I did understand the technology. Every time the rep from the company tries to explain but somehow they worked it out so it's streamlined and it works beautifully.
Oh, that's great. How many have you done so far in the office?
Oh gosh, probably a couple hundred, I think. We've had
Okay.
it for about a year and a half. So, and it is more expensive, so not everyone chooses it. Some people, for example, someone who has macular degeneration is not a good candidate for it. And a lot of patients are just used to glasses and they want to keep wearing glasses afterwards, so they don't choose it. It's one of those things. It's a great possibility for people that can afford it and really want to be glasses free.
Right.
I'd say my younger patients, my cataract patients who are on the younger end, which for cataract surgery means in their 60s or late 50s, they are more likely to choose it, I think.
Okay. Okay. Well, excellent. Well, it's amazing how many different choices there are these days, and you guys have all the doctors and all the technology, and congratulations on your new move.
Thank you. Yeah, it's a great, it has been just great for the pandemic to have office space. Our office, our waiting room, people never have to be more than 10 feet from anyone. And yeah, thank you. Yeah, it's been a great practice. I was the third doctor there, and now there's 16 of us. So it's been, a wonderful career, a wonderful place to call my home for work. And I'm very excited because our three newest doctors are all women, which is great for me because I was only women for so long. So I'm very happy. We have a new glaucoma doctor, a new retina doctor, and a new cornea doctor, and they're all wonderful. So, yeah.
Well, wonderful. Well, I really appreciate you taking the time out of your busy day, and we'll talk to you again soon. Hopefully we'll be in the studio by then.
Okay, I hope so. Yeah, thanks so much.
All right, thank you.
Okay.
Bye-bye. And we'll be right back after this.